Diabetes. Diabetes is a disease in which your blood glucose levels are too high. Blood glucose, also called blood sugar. Glucose comes from the foods you eat. Insulin is a hormone that helps the glucose get into your cells to give them energy. Without enough insulin, the glucose stays in your blood. Having too much glucose in your blood can cause serious problems. It can damage your eyes, kidneys, and nerves. Diabetes can also cause heart disease, stroke, and even the need to remove a limb. Types of diabetes. Diabetes is 3 types. Is type 1 diabetes, type 2 diabetes, gestational diabetes. First one is type 1 diabetes. Type 1 diabetes is also called insulin-dependent diabetes or juvenile diabetes. Type 1 diabetes occurs when your body's pancreas doesn't produce any insulin. Type 1 diabetes is usually diagnosed in children and young people. It can also develop in adults. 10% of people who are diagnosed with diabetes have type 1 diabetes. With type 2 diabetes, body does not make or use insulin well. It usually develop in adults. 90% of people who are diagnosed with diabetes have type 2 diabetes. Gestational diabetes. Pregnant women can also get diabetes, called gestational diabetes. During pregnancy, usually around the 24th week, many women develop gestational diabetes. A diagnosis of gestational diabetes doesn't mean that you had diabetes before you conceived, or that you will have diabetes after giving birth. Symptoms of diabetes. Symptoms vary from person to person. Common symptoms are extreme hunger, extreme thirst, frequent urination, unexplained weight loss, fatigue or drowsiness, blurry vision, slow healing wounds, sores, or bruises, dry skin, itchy skin, tingling or numbness in the hands or feet. Frequent or recurring skin, gum, bladder, or vaginal yeast infections. Darkening skin around the neck or in the armpits. High blood pressure. Cholesterol problems. Yeast infections and skipped or absent periods in teen girls and women. Risk factors for type 2 diabetes. Weight. Obesity is the single most important risk factor for type 2 diabetes. The more overweight you are, the more resistant your body is to insulin. Age. The risk for type 2 diabetes increases with age, especially after 45 years of age. Family history. Your risk for diabetes is higher if your mother, father, or sibling has diabetes. Diet. A diet high in fat, calories and cholesterol increases your risk of diabetes. A poor diet can lead to obesity or diabetes, and other health problems. Diabetic complications. Diabetic neuropathy, nerve damage. Diabetic neuropathy makes it hard for your nerves to send messages to the brain and other parts of the body. If you have nerve damage, you may lose feeling in parts of your body or have a painful, tingling or burning feeling. Uropathy most often affects the feet and legs. If you have neuropathy, you may not be able to feel a sore on your foot. The sore can become infected and, in serious cases, the foot may have to be removed. Swelling, redness and feel warmth in your foot. Numbness, tingling or burning feelings in your fingers, toes, hands. Cuts, sores, or blisters on your feet that also heal very slowly. Muscle weakness and difficulty walking. Erectile dysfunction, in men, and vaginal dryness, in women. Diabetic retinopathy, eye problems. Diabetes can damage and weaken the small blood vessels in the retina. When the blood vessels of your retina are damaged, fluid can leak from them and cause swelling in your macula. The swelling and fluid can cause blurry vision and make it hard for you to see. If retinopathy gets worse, it may lead to blindness. Signs of retinopathy: blurry vision for more than 2 days. Sudden loss of vision in one or both eyes. Black or gray spots, cobwebs, or strings that move or drift when you move your eyes. Pain or pressure in your eye. People who have diabetes should have an eye exam once a year. Diabetic nephropathy, kidney damage. Diabetes can also damage the blood vessels in your kidneys. This damage is called diabetic nephropathy. Protein in the urine is usually the first sign of nephropathy. This should be checked yearly. The risk for nephropathy is increased if you have both diabetes and high blood pressure. Heart disease and stroke. People who have diabetes are at greater risk for heart disease and stroke. The risk is even greater for people who have diabetes and smoke, have high blood pressure, have a family history of heart disease or are overweight. Or cholesterol is higher than the recommended level. Heart disease is easiest to treat when it is caught early. It is very important to see your doctor on a regular basis. Prevent diabetic complications. Eat a variety of healthy foods. Avoid foods that are high in fat, cholesterol, salt and added sugar. Maintain a healthy weight. If you're overweight, to lose weight safely. Keep your blood pressure at a healthy level. Below 130 by 80 mm Hg. Maintain a healthy cholesterol level. Under 200 mg. Be physically active on a regular basis. Quit smoking. Take care of your feet and check them every day for signs of injury and infection. Have an eye exam every year to check your vision. See your dentist twice a year to check your teeth and gums. Manage your stress. Symptoms of hypoglycemia: frequent yawning, being unable to speak or think clearly, loss of muscle coordination, sweating, twitching, seizures, suddenly feeling like you're going to pass out, becoming very pale, loss of consciousness. People who have diabetes should carry at least 15 grams of a fast-acting carbohydrate with them at all times in case of hypoglycemia or an insulin reaction. If you don't feel better 15 minutes after having a fast-acting carbohydrate, or if monitoring shows that your blood sugar level is still too low, have another 15 grams of a fast-acting carbohydrate. It will raise your blood sugar level. If you are unconscious, or you can't eat or drink, another person can give you a shot of glucagon. This will bring your blood sugar level back to normal. Symptoms of hyperglycemia: frequent urination, extreme thirst, blurry vision, feeling very tired. If your blood sugar level goes higher than it should, you may need to take an extra dose of rapid or short-acting insulin to return your blood sugar to the normal range. Eat at about the same time every day. This helps keep your insulin or medicine and sugar levels steady. Try to eat 3 times a day. Have a snack at bedtime if you are taking medicine or insulin. Avoid other snacking unless you're exercising or treating hypoglycemia. If you're overweight, lose weight. Even losing just a little weight, such as 5 to 15 pounds, can lower your blood sugar levels. Eat plenty of fiber. Green leafy vegetables, whole grains, and fruits are good choices. Fiber helps you feel full and helps with digestion. Eat fewer empty calories, such as foods high in sugar and fat, and alcohol. Exercise. Exercising will help your body use insulin and lower your blood sugar level. It also helps control your weight, gives you more energy and is good for your overall health. Exercise is also good for your heart, your cholesterol levels, your blood pressure and your weight, all factors that can affect your risk of heart attack and stroke. Exercise also seems to make people feel better about themselves and feel less anxious. Talk with your doctor about starting an exercise program. He or she can help you make a plan. Maintain a healthy weight. Losing excess weight and maintaining a healthy body weight will help you in 2 ways. First, it helps insulin work better in your body. Second, it will lower your blood pressure and decrease your risk for heart disease. Take your medicine. If your diabetes can't be controlled with diet, exercise, and weight control, your doctor may recommend medicine or insulin. Oral medicines, taken by mouth, can make your body produce more insulin or help your body use the insulin it makes more efficiently. Some people need to add insulin to their bodies with insulin injections, insulin pens, or insulin pumps. Always take medicines exactly as your doctor prescribes.